Good afternoon, class. My name is Bridget Moss, and today we will be discussing ethical principles and guidelines related to social media and healthcare professionals. Our, object- our objectives for this class will be to define social media networking, explore social network uses, explain positive and negative effects of expanding roles of social media networking in the healthcare profession, discuss key points to remember when utilizing social media tools, and discuss how healthcare professionals protect themselves when using social networking tools. What is social networking? Boyd and Ellison define social networks as web-based services that allow individuals to construct a public or semi-public profile within the bounded system, or articulate a list of other users with whom they share a connection, and view and transverse their list of connections and those made by others within their system. Examples of social networks, sites, and social networking tools would be sites such as Facebook, Twitter, YouTube, LinkedIn, MySpace, blogs, text messaging, webinars, and podcasts. And these aren't the only tools that are out there that may be used. One thing I would like to mention is the tools here listed may be used for various reasons. Facebook and Twitter can be used for personal reasons. LinkedIn is a program or a site that's used by professionals, where professionals can link up and share, discuss issues within their field. Blogs can be used to express personal opinions, and blogs can be used to send out messages across the board. Text messaging is widely used by many people. Webinars can be used as a teaching tool as well as podcasts. Social networking can be an extremely effective tool to communicate about issues that are occurring in healthcare, educating healthcare professionals on best practices, or educating the public on healthcare issues. Social networks also become a venue in which healthcare professionals can connect with each other on a professional level. Sharing experiences via social networking has become the norm. Nurses are increasingly using blogs, forums, and social networking sites to share workplace experiences, particularly events that have been challenging or emotionally charged. So, um, social networks in itself does have positive usefulness. And here we'll discuss the positive aspects of social networking. As mentioned before, social networking as a form of communication is effective for connecting with other healthcare professionals for various reasons. For example, uh, you have a team of healthcare professionals who have a patient who is newly diagnosed diabetic. Um, you have the physician working um, on behalf of the patient in addition to the nurse, and possibly also, most likely, a dietitian. Um, Social networking could be used in this um, in this example, uh, for the physician trying to contact the dietitian for a consult on the patient. Just to discuss some. There may be some issues that the physician wants to discuss personally with the dietitian or the nurse. So these are positive aspects, or there is one example of positive aspect of social networking. The National Council of State Board of Nursing states social media can benefit healthcare in a variety of ways, including fostering professional connections, promoting timely communication with patients and family members, and educating and informing consumers and healthcare professionals. Social networking has made communicating between healthcare professionals and also their patients very convenient. Social networking is also used um, between the nurse and the patient. You know, in particular, we may have a patient who has a chronic disease, and they're self-managing their disease, and they may have certain questions. Well, there is a way through social networking that the patient can contact the nurse or the physician and discuss issues of the chronic disease via social networking. Other positive aspects of social networking. Healthcare professionals can use social media to connect with specific groups of their interest. For example, American Geriatric Society and Oncology Nursing Society. Within social groups, healthcare professionals are able to receive minute by minute information and updates about healthcare trends and treatments. Through use of certain social networks, practitioners are able to order prescribed medications, answer questions, like I said before, proposed by their patients conveniently and resourcefully. And here we have a little diagram or a little picture here that says texting throughout the patient's life cycle. Through preventative care, the patient can contact the nurse, the physician. Appointments confirmations can be made via social networking. Post-visit surveys and account alerts can also be accessed via social networking. Negative aspects of social networking. Um, you have the positive, and yes, we do have negative aspects that we must discuss when it comes to social media, social networking. And one of the most um, talked about issues of social networking is violation of HIPAA laws. This is the largest concern when considering healthcare and social media. Employees may unprofessionally vent about their employers or workplace issues. This is another uh, matter that social networking, negative aspect of social networking. And it frequently happens. I myself have seen, you know, um, an employee be reprimanded because they put out on Facebook their feelings towards their workplace, and these feelings were very negative, and they were actually um, fired. I can recall for uh, the things that they had put out um, on the social media. Um, Also, unprofessional actions or words are not only viewed by those in healthcare arena, but they also may be seen or heard by the public. This in turn could cause ill feelings from the public towards healthcare professions. For example, there have been incidences where healthcare professionals have used social networking for negative causes, such as taking pictures of unconscious patients and texting these pictures to others. Now, this specific example is just legally and ethically wrong and should not be done. Key points to remember: confidential and privacy. It is important for the healthcare professional to understand the patient's rights to confidentiality and privacy, and recognize how these rights can be violated as they relate to new technology and social media. Confidential information should be shared only with the patient's informed consent. With only the patient's informed consent. The nurse's obligation to safeguard such confidential information is universal. Privacy in healthcare relates to the patient's dignity and respect. A violation may occur if a healthcare worker reveals information about a patient to where that individual is identifiable, or the healthcare worker shames or humiliates the patient. These actions are legally and ethically wrong, and perpetrators could be handled by the Board of Nursing or even in the judiciary system and face loss of licensure, fines, or imprisonment. And in the upper right hand corner, we just have a little comment. And it says, "Are my test results in yet?" And then the healthcare professional says, "Yes, you can see them on my website." Now we know this is just wrong. Moving on, more key points to remember. The healthcare professional must always remember boundary settings. Professional nursing boundaries are limits that protect the space between the nurse's professional power and the patient's vulnerabilities. In addition to this, it is also important for the nurse to set boundaries and avoid crossing these boundaries in order to protect the patient from potential exploits or harm. Always remember to protect your patient. Next, I just want to finish up with guidelines that were posted on the American Nurses Association website. And these guidelines are guidelines for nurses to follow for social networking. And there are 6 points that they make. And the first point is nurses must not transmit or place online individually identifiable patient information. Nurses must observe, ethically prescribe professional patient-nurse boundaries. Nurses should understand the patients, colleagues, institutions, and employers may view postings. Nurses should take advantage of privacy settings and seek to separate personal and professional information online. Nurses should bring content that could harm a patient's privacy, rights, or welfare to the attention of appropriate authorities. Nurses should participate in developing institutional policies governing online conduct. And this ends our discussion on ethical principles and guidelines related to social media.